Hello, this is Dr. Neil Baum from New Orleans, Louisiana, and I would like to use this video to discuss with you the importance of scheduling with the goal of seeing your last patient on time. I want to share with you that the inspiration for this video came from one of the executives from Grand Rounds in Urology who went to see his doctor and had to wait 1 hour in the waiting room in order to see the doctor. After that visit, he decided he was going to take his health care elsewhere. So the question I would like to raise in the beginning is, how many of your last patients of the day were you able to see on time? I advocate that for many, many years, we have gotten away with being delayed in seeing our patients. And I advocate that we can do better. So this video will cover why it's important to be on time and offer you 6 suggestions for being an on-time physician. So why is it important to be on time? The number one complaints that patients have is that they had to wait for the doctor in the waiting room and in the exam room. As a result, it makes the patients anxious. It increases their blood pressure. It reduces patient satisfaction. It diminishes their online reputation management. It increases the stress on the staff. And if you're paying for overtime because you weren't able to see patients on time at the end of the day, it can be very costly and expensive. So here are 6 suggestions for being an on-time physician. Choose your words carefully. Don't refer to that area that patients enter as the waiting room, because it becomes a self-fulfilling prophecy that that's where they have to go to cool their heels until the doctor is ready to see them. Instead, make it a point to have everyone, including the doctor, refer to that area as the reception area. Number 2, make a commitment to being on time. Doctors can't possibly maintain their schedule if they arrive 30 minutes late, and the first thing that they do is go to their computer and answer emails or make telephone calls. If you are chronically late for patients, it signals to the patients that they can be late. So late doctors lead to late patients. Number 3, manage the appointment types. Not every patient requires a 15-minute appointment. Follow-up examinations for BPH or testosterone deficiency may only require a 5-minute visit. However, a new patient or a patient with a new diagnosis of prostate cancer probably will require at least a 30-minute appointment, and that should be an open-ended appointment at the end of the day. So what my message is on scheduling is estimate the time it will take to see various patients, diagnoses, or medical conditions, and schedule them appropriately. Number 4, don't make any phone calls when you're in the examination room with a patient, and don't answer any cell phone messages. Patients do not appreciate the interruption any more than you appreciate patients answering their cell phone while you are in the room with the patient. The only exceptions might be the emergency room, the operating room, or the intensive care unit. Number 5, don't allow pharmaceutical reps or vendors to enter the office while you are seeing patients. It sends a terrible message to your patients if a pharmaceutical rep appears at the front desk and is escorted into the back office while patients have been waiting in the reception area. It sends a message that the pharmaceutical rep is more important than the patient. I suggest you schedule your meetings with the pharmaceutical reps and agree to see them on time if they'll adhere to a schedule. And finally, number 6, reward your staff if they are keeping your schedule and if you are seeing your last patient on time. A nice way to do that is to bring lunch for the staff, or even something as simple as verbally saying, thank you to the staff for allowing me to see my patients on time. Bottom line, being on time is not an impossible goal or objective. It's doable for all of us. We should have as the exception to being late, and the rule is that we should be on time. As a result, we'll have happy patients, happy staff, and a doctor who is not on a trajectory for burnout. I hope you found this video helpful, and maybe you can implement one or two of the 6 suggestions that I provided you for being an on-time urologist. Thank you.